getting started. Thanks for joining us. Today we are doing a removal of some implants. This patient actually got their implants done with Dr. J in 2006, and they are coming back to get them removed. We are doing a replacement and a revision today. We're also going to do a lift, and we're going to do some lipo to our patient's axilla. So if you guys are interested, y'all should stay tuned. Again, we're just getting started. It's our first case of the day. We have 2 today. So we'll be live for this one and our next one later. We'll be doing the facelift. We are also live here with Dr. Bam.
Take out the other one.
Hey there, Sarah, on Dr. Bam's TikTok.
What the?
I need a Decathlon.
Oh, you do? Hernandez can draw one up.
I travel from out of state for a mommy makeover. How many days do I stay? But that's a great question, actually.
Come on. John, your stuff today is so slippery.
That's a great question, Sarah. We do offer a lot of accommodation options. We actually have a overnight. We take patients overnight across the street here from where we operate. It may depend on the procedures that you get. But let me get a better answer to that question.
There was a longer one, but you broke the needle on that one, so. Here, let's switch up. It's a lot longer.
If someone travels out of state for a surgery, how many days should they stay?
It depends. Bigger surgeries, 2 to 3 weeks. Smaller surgeries, 7 to 10 days.
Okay, if you heard that, Sarah, if you're doing a larger surgery, more procedures paired together, they recommend 2 to 3 weeks. If you're doing something smaller, Dr. J said 7 to 10 days, but it is going to depend on what you have going on, what you're interested in, what our surgeons would advise. Great question, though.
I'm not if they can give us a trial run on
Over there. I'm excited. My surgery with Dr. Rocket is tomorrow. That's so exciting. Would you like to share what you're having done? Today, Dr. Rocket is actually over at our Maximus Surgery Center, and he should be going live as well for some of his procedures. But that's really exciting. How long have you been waiting for your surgeries? All right. I can't wait for my surgery in October. Hey, that's awesome. If you'd like to share as well, what procedures are you having done? And how long have you been waiting? Again, thank you guys for joining us today. We are just getting started. So we are doing a breast implant removal and a replacement. We're going to do a lift today, and we're also going to go in and do some lipo to our patient's axilla area.
Right here, guys. And then you don't have to stop being third person.
And then yeah, sir, of course. That's a great question. I don't even know all the little details like that either. So if you have any other questions that you'd like to ask, this is a great place to leave them. I'd be more than happy to inquire for you. their tubes on our YouTube. Thanks for joining us over there. Again, for those of you who would be interested in seeing our surgeons at work and the surgery itself, you guys can join us over there. It's going to be Dr. Jeneby Plastic Surgery on our YouTube. On our YouTube, we're able to flip the camera and show our patient, show our surgeon. We're able to show more over on our YouTube platform than we can here on our TikTok and on our Instagram. But again, for those of you just joining us, we are doing a removal of some implants. Our patient has had them in since 2006 and actually got them, got her breast augmentation with Dr. Jeneby back in 2006. So she has come back to him to remove those implants. They're going to do a revision, and then they're going to go in and do lipo to her axilla area. So that's going to be the armpit, kind of on the side of her breast, towards the side though. And again, we're just getting started. We've been live here for a few minutes, about a little less than 10 minutes. So we haven't been at it for too long. We do have one more case later today. That one is going to be a little bit more technical. We're doing a facelift, and we are doing a eyelid lift, so upper eyelid and lower eyelid lift. So we're going to remove that extra fold that you'll see that begins to sag over time. And then we will be done for the day. Again, if you guys have any questions, go ahead and leave those down below. So right now, Dr. J and Dr. Phillips, we have Dr. Bam here with us as well. We are working on removing those implants. So they just removed the right implant, and they've also removed the left implant. Thanks for joining us over there on Dr. Bam's TikTok.
I came in to really her bag. I just stuffed in.
I just got shit for the people that were there. Where was that? North Central. Starbucks. We got you. She said chest pain. Hard to. Yeah, like later. Could have been.
So hello, those of you just hopping on and joining us on our first case of the day. We are doing a removal of some implants that our patient had since 2006. So very long time. We're removing those. We're going to do some lipo to her axilla. We are doing a breast lift. So if you guys have any questions about that, what that looks like, go ahead and comment those down below. You can join us on our YouTube at Dr. Jeneby Plastic Surgery. Over there, we can actually flip the camera. We can show the surgeon. We can show the areas on the patient where we're operating. So if you guys are interested, you can join us over there. Again, it's Dr. Jeneby Plastic Surgery. We're live right now. And those of you who are with us on Dr. Bam's, it's the same thing. You can join us over there. Dr. Jeneby Plastic Surgery.
They're not downloaded. Really? But do they hook to TikTok? Do they hook to YouTube? All I know is you have to have like a separate monitor. Okay. Like that it's,
So do you need, are you
Wire-
And
filming
again,
a
we
monitor?
just removed those implants.
Oh, you're filming a monitor. Oh, yeah, that makes sense.
and then wherever you need the light.
So really, she'd be pointing one phone at the monitor.
Yeah.
Oh, yeah, that makes sense.
Now I know.
So, are you doing the J stitch right
Yeah,
now?
we're doing the lateral capsulorrhaphy.
Okay.
So that we reduce the size of this implant pocket. The implant says nowhere to go but that way. Up and in. Like it does that. Right up. Yep.
What?
Doing it now.
So yep, so about 4 days ago, I caught him drinking Ashley's lens contact solution. I'm like, what are you doing? I thought it was saline too, but then he pulled up this thing with his lasers. Contact solution at the time. He's been having a little bit of stomach upset.
Yeah, the cups.
Yep. For like 2 or 3 days. I'm like, but I'm like,
How did you get to that?
oh, it's right there on our thing, and I guess he outran me, and I didn't see him, and I went to go look for him. He's like, no.
Oh my gosh.
Phyllis knows those days.
That's crazy.
No, you didn't.
Oh, wow.
Standing there, I thought I could see both. It was like a, outside. I was standing where I thought I could see both legs, but I got past it. And my wife meeting us there, so she was there. I saw her pull in. And I'm like, all right, Emerson, let's go. Emerson.
Oh, God. How true.
So I was running around my place.
How true. Where'd she go?
Another little area playing.
Hello. For those of you just joining us, we're still on our first case. We're doing a removal of some old implants.
Anybody see a little kid? They're great story. It was great one day. It took on border bars.
And we're going to go in and do a revision and add some new implants. We're also going to go in and do some
I lost 2 out of 4 right off the bat.
lipo to our patient's axilla. So that's going to be this area right down here.
Oh, that's too funny. Bro. Chucky, lens contact. I was like, saline. So she was like sending me articles that night when you take the ER.
Don't overreact, bro. I overreacted to the first one, and then after that, bro, you know, kids know how to treat
Ant
the
and
first-
weed killer.
Kids know how to treat those around up, and you'll be all right.
At one. Hey, Dea, can you open up another pair of 8s, 4 foot more?
Poor
I have to call the next of kin.
Original. Next time we see him, you know what to do, right?
He has a punch card. The next one is gonna be free.
Owns a punch card. Subway and Jeneby books.
He wants a butler.
Oh.
And you get a free facial. 450,
We
right?
should do that.
Don't say that. You might enjoy that.
Woo! Get it, girl. Check it out, Johnny B. Yes, bro.
We just have to do the.
Hello. For those of you just joining us, we're doing a removal of some old implants and a replacement today. So we're just adding some new ones. We're going to go in and do a lift on our patient's breast. So we are working on adding those implants right now. Then we'll go in with that lift here shortly. We're also going to do some lipo to our patient's axilla area. So on both sides, like right down here past the armpit.
Why'd you cut this off?
Oh,
come on.
Come on, dude. Do you have a 5-in-1? How's the Christmas tree?
So we'll be live here with this patient for a little while longer. We're also live here on our YouTube, so join us over there if you're interested. Hey, Little Miss Texas on Dr. Boom Boom Pow. How are you doing today? We are doing excellent. We have 2 cases today. We're on our first case. We'll be working on our second case later. Y'all should definitely stay tuned because it is a facelift and an eyelid lift. It's more technical.
Come on, Dot.
Waiting in Dr. J. Waiting on Dr. J? Tell him I said so. LOL. Upstairs. Someone's waiting on you upstairs.
Someone's what?
Little Miss Texas?
Oksana.
Oh.
Little Miss Texas?
Yeah. She said, tell him I said I'm waiting on him upstairs.
Oh, shucks. Okay, tell her be there in less than 8 minutes.
All right. If you heard that, he'll be there in 8 minutes.
Dallas Cowboys.
I'll set a timer.
I'm in OT. It's the longest 8 minutes of your life.
That was yesterday.
There was a kid from Johnson High School.
Yeah.
Got drafted like 16th overall in the baseball draft yesterday.
Really?
Yeah.
Johnson is
Of course.
East of 281.
look at his fighting bone.
Again, for
who's the
those of you
quarterback for
just
UIW?
joining us, we are with our first patient of the day. We are doing a implant removal. We are doing a replacement. So we're taking out some old implants that our patient had since 2006. So the math on that, I don't know, that's like almost 20 years. So we are removing those old implants. We're gonna go in and add some new ones. We're doing some lipo to our patient's axilla area. So that's gonna be this area right here. We just finished adding those implants, and then we're gonna go in and do the lift. And our patient actually got her implants done in 2006 with,
Sorry, I didn't do any of that. You can't blame me this time.
with Dr. Jeneby.
Because you didn't put it back to where it's supposed to go.
Back in 2006 when he was first starting out, so she decided to come back. So it's a really interesting case. We will be posting a video about that later in the coming days or coming weeks. So look out for that. And then again, our second case, our last case of the day, is going to be a facelift and an eyelid lift. So right in here, we just remove that fold that you'll see after years of aging, it begins to sag.
Okay, sit her down. Yes. All right, we're going to be closing her up. You can give everybody 30 seconds.
All right. All right, you guys, thanks for joining us for our first case. We appreciate it. If y'all are ready to take the next steps, we do have a form here that's pinned on both platforms here. Once you fill it out and submit it, somebody from our team will reach out to you. Again, this was our first case. We have one more, so stay tuned for that. And we will see y'all in a little bit. Thank you.